and now partnering to get the vaccine to those who want it and need it, and we need to move forward. And thanks to you, we are making great progress. So I'm grateful to all of you. I want to acknowledge other colleagues from the County Commission that I saw in the gallery. We have Commissioner Eileen Higgins, Commissioner Daniella Cohen-Higgins, in addition to, I was going to say Chairwoman, Rebecca Sosa. I don't know if there are others. I did not see them yet. We are expecting others to join. So this is a partnership for the most vulnerable in our community, starting with our 65 plus years old residents and our healthcare workers. And I want to make sure everybody understands, if you didn't already, we are truly in an emergency situation. This is not business as usual. This is a crisis for our community. We have activated our Office of Emergency Management to coordinate vaccine distribution countywide. We're going to give you an update on how we are handling this emergency in coordination with all of the partners and others, all of those who are on the call. Truly all hands on deck to get shots in the arms without delay of those 65 plus and our healthcare workers in our community. As county mayor, my top priority is to bring all of these organizations, these agencies together, the cities, so that we can have a vaccine distribution plan with one table, facilitate coordination and communication, make sure the public has access to good and clear information, which is what they are seeking, and to distribute these vaccines as quickly as we possibly can to those who need it the most. As of this week, we have already been able to vaccinate over 30,000 people in Miami-Dade County. And just today, Jackson was able to schedule over 12,000 additional appointments for seniors 65 plus. We have heard loudly and clearly from our seniors that you are ready for the vaccine. That is the very good news. The demand is much greater than the supply currently available. So please know we are doing everything in our power to distribute these vaccines safely and efficiently as we continue the massive effort to get these vaccines into the nearly 500,000 people over 65 years in our community with great urgency. As we get more supplies, we will make them available as fast as possible, working with this network that we have established. So at the county level, in county government, we are focused on getting to the most vulnerable and the hardest to reach residents. That includes seniors who live in our public housing and people with special needs. As we speak here today, our telephone callers are reaching out to these to schedule vaccine appointments for them. And additionally, we are convening and coordinating with all public and private partners, including the leaders on this call, to distribute vaccines to the community as quickly and as efficiently as possible. All of us understand that we have different but equally important roles to play in getting our population vaccinated as we follow the state guidelines to distribute vaccines to healthcare workers and seniors over 65. We've also provided a one-stop information hub, miamidade.gov/vaccine, and this provides real-time updates to the public on where the vaccine is available and how they can register. This website is also available in Spanish and Haitian Creole. You can visit miamidade.gov/vacuna or miamidade.gov/vaccin to access the information in both languages. We're also working with the state of Florida to explore making drive-through vaccinations available at testing locations such as Hard Rock Stadium, and others. And we'll be sharing updates as they become available. Our goal is to ramp up to be able to provide tens of thousands of vaccines weekly, countywide, but activating more of these large-scale distribution sites and by working closely with our hospitals, our clinics, the Department of Health, and our cities. And I want to address the many important concerns about how we are ensuring that vaccines are distributed equitably and fairly across Miami-Dade County, and how we will ensure that those who do not have easy internet access are not excluded from this process. So as I mentioned, Miami-Dade County is focused on directly calling the vulnerable, hard-to-reach seniors in county care to schedule appointments for them directly. And we are visiting homebound seniors directly to vaccinate them. We're arranging transportation for those who need it to access a vaccination site. And for those without computers or Wi-Fi at home, our libraries have both for free at locations throughout the county. So we are working with our state government, our hospitals, the Department of Health in Miami-Dade County, and we're activating as many vaccination sites as possible across the entire county to ensure that in all those neighborhoods there is easy access to a vaccine site nearby. So thank you once again to all of the wonderful leaders who are on the call today for your partnership on this effort, to the members of the media for your critical role in educating the public, communicating this information clearly to help those who are anxious understand that help is on the way. And to all the members of our community who are watching, we are here for you. We want to be sure you get the information that you need. So we are entering the final critical chapter in this fight against coronavirus, but we are not in the clear. We are not out of the woods yet. And the only way out of this is vaccinating as many people as possible, as fast as we possibly can. And we cannot let our guard down. I am fully committed to ensuring that the most vulnerable members of our community can access the vaccines as urgently as possible, and we will be working harder than ever to make this happen. Rachel, if you would like me to speak in Spanish now or later, please advise.
Yeah, I think now. Do you have it in front of you?
I do. Thank you.
Great.
Okay. Unas palabras en español. Gracias a todos por unirse a esta importante actualización para la comunidad sobre los esfuerzos para distribuir la vacuna COVID en el condado de Miami-Dade. Quiero agradecer a todos por este esfuerzo para vacunar de la manera más rápida y eficiente posible. Y como alcaldesa del condado, mi prioridad es reunir a todas las agencias que trabajan en la distribución de vacunas y facilitar la coordinación. Hemos activado nuestra oficina de manejo de emergencias para que sea un punto de coordinación para todos estos esfuerzos en el condado. A partir de esta semana, ya hemos distribuido vacunas a casi 30,000 personas en Miami-Dade. Y hoy Jackson pudo programar más de 12,000 citas adicionales para personas mayores de 65 años. Estamos haciendo todo para distribuir vacunas de manera segura y eficiente y le pedimos paciencia mientras continuamos este esfuerzo para vacunar a casi 500,000 de personas mayores de 65 años en el condado lo más pronto posible. Estamos contactando a las personas mayores en viviendas públicas y las personas con necesidades especiales para que puedan ser vacunados. A partir de hoy también tendremos un número limitado de espacios para citas. Las personas pueden visitar miamidade.gov/vacuna y también está disponible en español miamidade.gov vacuna y creole miamidade.gov/vaccine. También estamos trabajando con el estado de Florida para que las vacunas están disponibles en lugares de prueba como los estadios. Además, para aquellos que no tienen computadoras o Wi-Fi en casa, nuestras bibliotecas pueden dar ese servicio gratis para que accedan a los sitios web. Gracias una vez más a todos los líderes aquí presentes por este esfuerzo, a los miembros de los medios por comunicar esta información al público. Gracias.
Thanks, Mayor. Now we'll hand it over to our Commissioner Sosa to speak.
Thank you. And do we know if we have Chairman Diaz or Vice Chair Oliver Gilbert on the line?
We're finding out right now if they can join us. If you want to go ahead and say a few words, and we'll.
I'm only going to say that we are united on this, and I thank you, Mayor, and to all the mayors of Miami-Dade County and all the experts. And Jackson, we are so proud of you. I also see the representative from Don White. I see Baptist. I see all the hospitals together. It's wonderful to see you, the port, the airport. The only way we're going to be able to control what is happening, having more than 3,000 new cases today is scary, and people have to be very afraid of what we're going through, and the only way is the vaccines. So let's continue, and whatever you need, Mayor, from us, the commission, to support that. We are here because the health of our community is our priority, and I think that we need to unite forces also to think about the teachers that are in the classroom every day that are exposed to the children, so we can control more and more the numbers that we have in Miami-Dade County. Thank you very much on behalf of my colleagues, and I hope the chair and vice chair will be here soon.
Great. Thanks so much. And now I'll hand it over to Jackson Health President and CEO, Carlos Nagoya.
Thank you, Rachel. Good afternoon, everyone. Let me start off by what we're doing at Jackson and some of the things we're working on throughout the community, because I think it's very, very important to understand. This morning, we opened our website to be able to provide appointments for the first 14,000 appointments. We have 2,000 a day for the next 7 days. We have, as Commissioner Cava said, in the first 2 hours, we were able to sell out of the first 12,000 of those appointments. I think any second will be completely sold out from all of them. So everybody knows we are not setting appointments unless we have vaccine for those appointments. We are working with the county, with the state at this point in time, to find out when the next allocation that we will receive. We're expecting to get that news sometime Thursday or Friday. Once we know what allocation we will receive, we will add appointments to the number of allocations that we have received, so that we are not overselling what our supply is. That's important to what we're doing at this point in time. And in addition to doing that, at the same time, we're actually vaccinating our employees. We had over 5,000 employees, UN physicians and community physicians that we vaccinated from the first doses. We're doing the second doses. And in addition to that, we are also transferring the doses to our partner hospitals throughout the community that are all here today. As a matter of fact, I think most of them are here. And I see Bo, I see Stephen, I see which Baptist of Mount Sinai. I guess I should be more specific. Sorry about using names. But obviously everybody's here, and we're transferring so they can also vaccinate the second doses for all the healthcare workers. So we're quite busy from that standpoint. In addition to that, I want to try and level set what this means. We have 465,000 residents of Miami-Dade County that are over 65 years of age. We're not expecting 100% of these over 65 to get vaccinated, because it's obviously a voluntary thing, not a mandatory thing. But we believe that 50 to 60% of them would want to be vaccinated. So one of the things that we've been working with Mayor Cava and other municipalities and everybody working together, and the hospitals, is how to be able to provide enough vaccination to get this done in a reasonable period of time. As Mayor Cava said, the governor was here yesterday, and he will be opening the drive-through site, the state control at Hard Rock Stadium. We're working on trying to get 2 other sites done within the next week to 10 days. We are obviously, there's 2 parts of that, the operational side and the supply side. And I'll talk about the supply side at the end of this thing. We believe between these 3 sites that we could do 10,000 a week, 10,000 a week and each of these sites. So that would be an additional 30,000. We're also working with Dr. Villalta, Department of Health, to try to get our providers, specifically more than anything, the HMO Medicare providers, to be able to vaccinate their own members. We're lucky enough that yesterday we were not only getting the first provider already credentialed, which was the Leon Medical Centers. They have 40,000 members. We're working getting Humana, who has a similar amount. So if you add up 80,000 of those 2 alone, that's approximately 20% of the population of over 65. So they can vaccinate those people themselves, and not just the only ones, but they're the 2 largest. So if you start adding all these up, and in addition, all the other partner hospitals that we have here that will also have their own supply of vaccination, plus we're also talking about FQHCs, we believe that we can provide between 65 and 75,000 vaccinations a week, subject to having the supply of vaccination. So we're talking about the operational side. We are talking directly with the Department of Emergency Management for the state, Director Moskovitz, who tells me that this coming week he will have 250,000 vaccinations for the state. In order for us to be able to have that 70 to 75, he needs to get to 500,000. He believes in the next week to 2 weeks, he will get to those kinds of levels from what he hears from the federal government. So we believe we're in line to be able to be at that point of 70 to 75,000 a week. Now, what does that mean? What that means is that if we start getting to that number in a 3 to 4 week period, we can get to 250,000 to 300,000 people over 65. And that would mean that 50 to 60% population of over 65, which means by the end of January, early February, we could have the elderly population vaccinated. Next in line is those people at risk. There's approximately another similar number of people at risk. So we could actually, by the end of February, early March, have those people completely vaccinated as well. And then followed by the masses. And we keep going at that 300,000 a month rate for March and April, we could potentially vaccinate 1.2 million people in Miami-Dade County by the end of April. I know I'm throwing a lot of numbers at you, but I think it's important for everybody to understand that if we get to 1.2 million people of Miami-Dade County vaccinated by the end of April, we're at 40% of the population of Miami-Dade County. That plus those that are infected already, have been infected in the past with COVID, we are closer to the 50 to 60 percentile, which gets us close to the herd immunity. So the goal here is in the next 4 months, by the end of April, to have enough people vaccinated in Miami-Dade County without having to grow a lot more, and by keeping very large places in which we can have enough throughput of vaccine to get these people vaccinated and get it at that rate of 75,000. Any more that we be able to do that, obviously we'll get it quicker, but in level setting this environment, if anybody would have said that we'd be able to get to those kinds of numbers by the end of April, we'd all be applauding. I remember many calls that we were having early on before we even knew vaccinations existed, that if we were at these numbers by July or August, we'd be feeling good. So that is the current plan today. So depending on what the supply is, depending on any additional operational needs, we can make this shorter, but we can at least have a reasonable period of time in which to do this. I want you to say again, in working with with the entire group here, what's really exciting about Miami-Dade County is, and I can say this because I'm not a public official from that perspective, we're not working with politics here. We're not working about competition. We all hospitals compete against each other for other things, but right now we're all working together for one common goal. All the other public officials, all municipalities, everyone here, FQHCs, everyone here is working with one goal only, and that is to vaccinate as many people in Miami-Dade County to eradicate this pandemic as quickly as we can for everybody in Miami-Dade County. Even for Hialeah, Mayor Hernandez, we want to make sure you're taken care of too. So seriously, I want to make sure that everybody understands that that is the goal we got going. Jackson's committed to doing our 15,000 a week that we're doing, and we've started, and we believe the state will be able to continue to provide this. Again, it's not up to the state. It depends on the federal government and depends on manufacturing. But the way this is all going and the way it's growing, we believe that we're optimistic that we're going to be able to get the supply that's coming on. So I think that's everything I needed to cover at this point in time. So you want me to say this in Spanish, Mayor? If I can remember, since I didn't script it.
Maybe you just want to do a little bit about the numbers in Spanish to make sure that is clear.
En Jackson en este momento estamos vacunando aproximadamente 2,000 personas por día. Esta mañana abrimos el website para empezar a hacer las citas sobre esta y en 2 horas vendimos todas las citas para los próximos 7 días. Estamos esperando a que recibimos adicional números de vacunas, que esperamos que para el jueves o el viernes tengamos esa vacuna para poder abrir citas adicionales en la próxima semana. Aparte de las 2,000 personas por día, estamos también cooperando no solamente con el condado, con todas las ciudades, con todos los HMO que tienen Medicare para tratar de expandir esto. El gobernador va a estar abriendo el primer drive-thru posiblemente en el Hard Rock Stadium y nosotros en el condado y la ciudad de Miami vamos a estar tratando de abrir 2 localidades más, las cuales entre las 3 vamos a tener 10,000 vacunas semanales en cada una de ellas. Aparte, estamos hablando con los HMO. La primera que ya tiene sus propias vacunas es el León Medical Center, que van a tener sus pacientes vacunados a un nivel de 10,000 pacientes por semana, y van a haber otros HMO con las mismas cantidades. ¿Qué estamos haciendo con esto? Entre esos y todos los hospitales y los FQHC y los demás, estamos hablando de poder vacunar de 65,000 a 75,000 pacientes por semana. A este nivel estamos esperando que a finales de este mes de enero o primera semana de febrero tengamos vacunados todas las personas mayores de 65 años de edad. Después de que tengamos este grupo ya vacunado, el próximo nivel va a ser personas que tengan otras clases de condiciones. Esperamos estas personas poderlas vacunar en el mes de febrero, y después las masas normales de personas saludables poderlas vacunar entre marzo y abril. ¿Qué quiere decir esto? Al nivel de 300,000 vacunas por mes, vamos a poder vacunar 1.2 millones de personas a finales de abril. Y con este número, aparte de otras personas que han estado ya anteriormente afectados por esta infección, vamos a tener suficiente población de 50-60%, donde vamos a tener una inmunidad bastante posible para la comunidad completa y poder erradicar lo más posible esta enfermedad. Estos son los niveles que estamos funcionando en estos momentos, estos son los planes que estamos haciendo. Todos los municipios, todos los hospitales, todas las diferentes organizaciones estamos trabajando con una sola meta delante de nosotros, que es vacunar las más posibles personas que quieran ser vacunados en los próximos 4 meses, y con eso poder eliminar lo más posible esta clase de infección. Muchas gracias.
Excuse me, Carlos, if you could just mention why it is that we're counting all the doses that we receive and why we're confident we'll get the second dose from the state.
That's actually a an extremely good point. Everybody is concerned about the fact that we're going to get the second doses. We've been assured by the manufacturer that whenever we receive the first doses, that the second doses comes back automatically. Remember, at this point in time, we're only getting 2 vaccines, Pfizer, and we're getting Moderna, both of which require a second doses. And the manufacturers have all been giving us the guarantee, not just the government, but the manufacturers, that once you get the first allocation, you will receive the second allocation as well. So that is a guarantee, and thank you very much for that, Mayor Cava. In addition to that, the state and the county are both going to be measuring not only the doses that every organization has been receiving, but the number of vaccinations that every organization is doing. So if anybody's sitting on any doses, the governor has already talked about, just like New York has been doing, by the way, that they will take some of those vaccinations away from those organizations and give them to other ones that are being vaccinated. So the encouragement that we have from everyone is that the moment you receive those vaccines, that you have to be able to make sure 100% of them are given out within a 7-day period. And that's the encouragement that we have, is having every organization working 7 days a week vaccinating, and having all doses that are given to be given out within a 7-day period on a regular basis, so that we can continue to vaccinate at that weekly rate. Thank you very much.
Great, thank you. Next up is Mount Sinai Medical Center, President and CEO, Stephen Sonnenreich.
Thank you very much, and I want to thank the mayor and all the mayors and all the community leadership for your interest and all of your support. I particularly want to mention my good friend Carlos Nagoya, who I am so proud of, who was a great banker and is now a great healthcare administrator, and appreciate Carlos's leadership and friendship throughout this pandemic. At Mount Sinai Medical Center, we've already vaccinated approximately 6,000 individuals. We have 11,000 people who are scheduled for vaccines in the coming 3 weeks. We're in the process of standing up an additional location at our freestanding emergency department in Aventura. We're also in the process of standing up an additional location at our freestanding emergency department in Hialeah in the next couple of weeks. We expect that we'll be able to grow our daily vaccine rate, which is currently at about 650 vaccines per day, to with the 3 locations, we expect to approach 2,000 vaccines a day. Carlos threw out a lot of numbers, which are very important. I believe that the most important numbers, are the 450,000 individuals that are 65 years of age or over. They are clearly the most vulnerable. They clearly have suffered the most through this pandemic. And reaching out to those elderly is our most important initiative right now, in addition to healthcare workers and to first responders. With that being said, from our experience, unlike the rest of the population, the elderly population seems to want this vaccine at a rate of nearly 100%. At least that's been our Mount Sinai experience. Those people welcome the vaccine, as do physicians. In vaccinating our medical staff, we've noticed that 100% of our medical staff and physicians that I talk to are interested in this vaccine. And that has to be the focus of our attention, to continue to focus on vaccinating the 450,000 seniors in our community. And by doing that, we will go a very long way in terms of decompressing our hospitals, particularly our hospital ICU units, and particularly the morbidity mortality rates that we're all experiencing in this county and what you're seeing happen around the country and around the world. So with that, it's a pleasure to be with all of you and working with all of you, and appreciate all of your support as we move forward in this pandemic.
Great, thank you. Next, we're joined by Baptist Health South Florida CEO and Executive Vice President Bill Bollinger.
Thank you very much, Rachel, and thank you very much, Mayor, commissioners, all the public officials that are here on the call, and all the concerned journalists and community members. It's a pleasure to be here. I want to emphasize what Carlos and Steve said, is that this is very much of a united front. We're all working very closely together with government and city officials and with each other to try to deal with the challenges associated with this pandemic. During the last few months, we've been humbled by the work of our extraordinary caregivers who literally saved lives and served our community with selflessness and resilience. Across our hospitals, urgent care centers, and the other hospitals that are on the call, our healthcare workers have been true heroes. And they continue that fight as we speak on the front lines on this pandemic, day after day, despite great physical and emotional toll that I'm sure all of us have seen reported in the media, but we can, us healthcare leaders can certainly attest to it personally. We at Baptist Health began this rollout by offering the vaccine to all of our frontline healthcare workers and physicians 3 weeks ago, thanks to the generosity of Carlos Nagoya and Jackson Health, are loaning us part of their first Pfizer delivery. So thank you very much, Carlos, for that. We won't forget you. To date, Baptist Health has vaccinated more than 8,200 of our frontline employees and medical staff in the 4 counties we serve. And we're committed to expand each day those that qualify for the vaccine. By the end of this week, we will have vaccinated 10,000 people. We're doing 1,800 vaccinations a day. We're quite a large organization. We have 11 hospitals and 25 urgent care centers. So we have 18,000 frontline employees who qualify for the vaccine, and many, as you heard from Steve, many want it. So we still have work to do those frontline people, and we're certainly making progress. We're committed to ensuring that all of our healthcare workers on the front lines who want the shot are able to get it so that they can continue to take care of the patients that are visiting us and needing our services in this third surge. We're also reaching out to community physicians who wouldn't otherwise have access to the vaccine to coordinate vaccination of them and their office personnel so that they can continue to function and take care of people in our community. Now, based upon the most recent directive from the governor to vaccinate as many people as possible, as quickly as we can, we've begun to coordinate vaccines for other vulnerable patient populations. And we're starting with our cancer patients at the Miami Cancer Institute and the Lynn Cancer Institute and other patients that have extreme risk factors for COVID-19. We're reaching out to these patients personally, individually to schedule their appointments, and we'll do so based upon vaccine availability. Reaching out to these patients who know us is just one step in the process of making sure that those who qualify for the vaccine in the early phase are able to get it quickly and efficiently. We're receiving the vaccine continuously, and as quickly as they're delivered, we're getting them into people's arms. We're not sitting on any vaccine. At the same time, we're continuing to make plans to be able to provide vaccine on a much wider scale for those who qualify in our community. We're developing an online registration system, which I'm told will be available late next week. Vaccine distribution of this magnitude, as you can imagine, is an extremely complex process, requiring a high degree of pharmacy expertise and skill and the right infrastructure to support it. It's not as easy as it looks. We're working to scale up a system that's easy for the community, and we look forward to sharing our plans in the coming days. We're also working with state and local leaders and other organizations to identify community vaccination sites as quickly as possible. Public-private partnerships with local municipalities that will be announced soon. One very promising and exciting development is we're working with academic partners in 4 counties to establish widespread sites for the vaccine for our community. For example, Dr. Saxton is on the call. We're working closely with FIU to try to develop a large site on the FIU campus. We know that our community is anxious to receive this vaccine. We all are, and we're doing all that we can to build a process to get them to people quickly. In the meantime, we're making sure our healthcare workers and most vulnerable are vaccinated. So this is a dual mission. COVID-19 continues to surge in our community. As we speak right now, Baptist Health is caring for 460 patients hospitalized with COVID. 30% of our hospitalized patients are in with COVID. On a success story, we've discharged 9,500 patients with COVID since the beginning of the pandemic. That's 10,000 people who were able to recover and be with their family thanks to the incredible work of our care teams and those hospitals that are also on the call. We're working at breakneck speed to get these vaccines to the most vulnerable in our community. Believe me, it's our priority to expand these efforts as quickly as possible so we can vaccinate more members of the community and fight the virus on every front. And we're doing it in a very coordinated fashion with county, city, and other hospitals. Thank you very much.
Great, thank you. Now I'll hand it over to City of Miami Mayor Francis Suarez.
Thank you, Rachel. It's a privilege to be on this call with all of you. I know how hard everyone is working to try to get this vaccine to as many people as quickly and as safely as possible. I want to thank the county mayor and all those who are on this call, all the mayors who have been in constant communication with each other on trying to formulate a plan to scale as much vaccine distribution as we possibly can, as quickly and safely as we can. Today, I was with the mayor on a phone call with the CDC director and the head of the coronavirus task force, and they were continuing to emphasize how important it is for us to continue to mitigate despite the amount of growing cases and the fact that the hospitalizations continue to increase and that we're getting closer and closer to our summer levels, even though we're at about 50% of those levels. But if the mitigation we're not allowed to continue to mitigate, and we're not able to vaccinate at a rate that that is sufficient, we're going to have a continued loss of life, like we've seen tragically over the last few months. So the city of Miami is a willing and able partner. I'm thankful that the mayor and so many others have reached out to try to get the city of Miami to participate in this process. We're hoping to activate a site in the city of Miami soon, and we will hope to be able to administer as much vaccine as we're given. Obviously, I think at some point we're going to have to really ramp up our efforts to get enough vaccine into the general population at the levels that we need to in a reasonably quick fashion. So I think all of our efforts are going to be aimed towards understanding how is the most efficient way for us to be able to scale up as quickly as possible. And we're going to be working diligently day in and day out, sparing no effort and no expense either, because as I mentioned earlier, I spoke with the CDC director and Mayor Levine Cava was on that call. And we talked about how, the U.S. Congress has allocated $8.5 billion approximately to vaccine expenditures, 4.5 billion of which has to be given to state and local governments to administer the vaccine. So we're going to be getting some clarity on that so that we can ramp up to the level that we need to ramp up given whatever levels of vaccine we're given so that we can administer it as quickly and as comprehensively as possible. So I'll just say in Spanish quickly, es un placer estar aquí en esta llamada con los otros oficiales electos de las ciudades y los directores de los hospitales de nuestra comunidad. En la ciudad de Miami, nosotros estamos asociándonos con estos esfuerzos para asegurar que las vacunas están disponibles lo más rápido posible, en la mayor cantidad posible, para ayudar a nuestra comunidad, poder parar la propagación de este virus que ha desafortunadamente tomado tantas vidas en nuestra comunidad. Vamos a poder administrar suficientes vacunas a base de lo que nos van a dar y la necesidad que tenemos en nuestra comunidad, pero vamos a enfocarnos en continuar a expandir nuestros esfuerzos a poder proveerlo, porque la cantidad de personas que tenemos que vacunar es en los millones y lo tenemos que vacunar 2 veces, una vez y después en aproximadamente 20 a 30 días una segunda vez. Así que vamos a continuar a trabajar conjunto con todas las personas en esta llamada para asegurar que podemos aumentar nuestra capacidad lo más rápido posible, lo más antes posible y de una forma segura para que nuestros residentes puedan inocularse de este virus tan peligroso en nuestra comunidad.
Great, thanks, Mayor. Next up is City of Miami Beach Mayor Dan Gelber.
Here we go. Thank you. First of all, I appreciate the efforts of our county mayor. Bringing order into disorder is not easy, but in this instance, it's so critical. And I want to thank all the other public servants and the healthcare leaders, and frankly, their dedicated staffs who have done so much over the last months in protecting our community. Today, it was reported that more than 3,300 infections were reported in our county. Now, our biostatisticians suggest that means about 160 of them will be hospitalized and upwards of 20 of them will tragically succumb to this disease. This has become a tragic exercise in math. Every day, the suffering piles up. So every day we push the vaccine out is a day of less infections, less hospitalizations, less deaths, which is why we need the vaccine. Miami-Dade County is one of 67 counties in Florida, yet we have shouldered about 20% of the infections and 20% of the deaths in the entire state. Last I looked yesterday at the count, we have received about 11% of the vaccine. If this community is going to suffer 20% of the pain, we damn sure need to get more than 11% of the solution. We are the undisputed hotspot of the state. Our county alone has had more deaths than 23 states. We need more vaccine and we need to get it out immediately. Cities and counties can help with the logistics and the support. And my city stands ready to do whatever needs to be done, whenever it needs to be done. Last week and nearly every morning since, our city began transporting members of our congregate living facilities in city buses to our local partner, Mount Sinai, to receive vaccines. Our EMTs have been trained for the vaccine. We have an industrial fridge we rented a few months ago, and a few hours ago received our first allotment of vaccines. So as early as tomorrow, our city will begin providing the vaccine to homebound seniors and other populations that may not find it easy to get to the hospital. I guess the point is this, my community, I think all our communities, I know Mayor Suarez feels the same way, and I know Mayor Levine Cava feels the same way. We are prepared to aid this effort in any and every way. We have trained personnel, we have a convention center. If you give us the vaccine, we will push it through to the public and help our healthcare providers in any way we are allowed. The point is, every day we are unable to deliver the vaccine translates into more hospitalizations, more death, and more suffering. We need the vaccine. We need it delivered like people's lives depend on it. So please, let's get the vaccine here. Let's get it in an amount that makes sense for a community that has suffered so much.
Thanks, Mayor. And last but not least, we'll hear from Dr. Yesenia Villalta, who's the Administrator and Health Officer for the Florida Department of Miami-Dade County.
Thank you so much, Rachel. Good afternoon, everyone. Thank you so much, Honorable Madam Mayor Levine Cava, for working together with the Florida Department of Health and partners here today as we work to administer vaccines. Our department is implementing the COVID-19 vaccine and working collaboratively with county agencies, various municipalities, and the healthcare community to build up Miami-Dade vaccines capacity. We are ensuring that everyone who desires to be vaccinated will have safe and healthy vaccine access. Under Governor DeSantis' executive order, your local health department focuses our vaccination efforts on EMS, first responders, healthcare providers, and 65 and older individuals. In addition, we have a team of nurses connecting with critical primary care centers that serve our community members who are 65 and older and assist with provider vaccine education and enrollment to receive the vaccine shipments. As early as next week, our department finalizing plans to open additional COVID-19 clinics to provide more opportunities for you to get a vaccine. Our department's goal is to always keep everyone in Miami-Dade County healthy, and especially during this time. While we know getting vaccinated isn't always comfortable, you can play a big role in this pandemic. One way we can keep each other healthy, support our healthcare workers, and to get Miami-Dade County back to normal is to get vaccinated against COVID-19 and continue with the prevention measures of wearing a mask and physically distancing. When we get vaccinated and follow these guidelines, we can help our nurses, our doctors, businesses, schools, and fellow community members. Thank you.
Great, thanks so much. So now we have some time for questions. There are a lot of people on this call, so I ask that you please put your hand up in the Zoom if you have a question, and we will try to get to all the folks who have questions in the time that we have. And wanted to also mention that the Haitian Creole translation of this press conference will be available online following the press call. So we'll start with a question from Alyssa Hyman-Diamond. If you can.
Hi, Rachel, can you hear me?
We hear you, yeah.
I actually have two questions. The first is going to be for Mr. Nagoya. Can you talk a little bit about the process for the registration for today? We were hearing from a lot of people who felt like they missed out because they thought it started at 11. Can you talk about when it actually started and what people needed to know and when it actually filled up?
We were actually, when we talked about this yesterday, we said that we were hoping to get it up by 11. Obviously, the challenge that we had with, as you would imagine, I'm not an IT guy, but I can tell you these things are quite complicated, that we were trying to get this up as fast as we could. We did get it up sometime around shortly after 9 a.m. This being Miami and the fact that people don't follow rules. They have been looking at the site well before 11 o'clock in the morning, and by I believe 11:15, 11:20, all sites, all appointments were booked. The good news is we booked all the appointments to people that needed them, and they all qualified over 65. So, but that is the challenge, that we have a very limited number of appointments to a very vast population that wanted it. By that point in time, by 1 o'clock today, I can tell you that we had over 80,000 hits on that website. So we're talking with the state to make sure that we can get as many allocations as possible as quickly as we can. And the moment we do, we'll make more appointments available.
Thank you so much. And then I do have a follow-up question. This one might be for Mayor Cava. I know the focus right now is on those in the age group 65 and up and the frontline medical workers and our first responders, but we're also hearing from a lot of concerned parents, people with really severe autoimmune diseases or conditions that have made them particularly vulnerable. Do you know when we might to see more of the vaccines opening up to that section of the community? I know that Baptist Health mentioned, opening it up to cancer patients, but are we going to see that in any wide scale anytime soon? And if so, when?
So Governor DeSantis has the opportunity to set the priorities. And as you know, he set them as he did for 65 plus and the frontline healthcare workers. By the way, we heard today from the White House, from Dr. Birx specifically, that they're finding that prioritizing seniors is a good strategy, that there are several other states that are doing that. I think she said Texas and, one other state. So that was interesting that they're finding that's an effective first rollout strategy. I believe we heard Carlos Nagoya say that with the current schedule that we're hoping we can achieve, that by February, the end of February, by February, we should be ready for the next priority population. I do not know whether the governor has specified where he wants to go with that. I don't know if you know, Carlos, but for sure, you're making a very important point. Vulnerable, critical. Also, Commissioner Sosa raised the teachers as a priority area. Our children are going to school. We need to make sure that our teachers are healthy. We have many teachers with underlying conditions, or it's a serious situation. So I'm not sure what the governor's next.
The governor's statement yesterday with us, Mayor, was the fact that he believes the next level is those at risk under 65. So
at risk, but not naming exactly what that.
Not at this point. He will get there. But obviously, we got a couple of weeks before we get there. You're absolutely right.
And anyway, we're going to be talking to him about what we think is a good strategy.
Great, thanks. We're trying to get to everybody, so please just try to keep your questions to just one per person. And if you have follow-ups, I'm happy to help answer them following this call. Ty Russell is up next.
Yeah, just so people will know, is there some sort of accountability where there's a website that they can go to know how many doses are in Miami-Dade, where are they going, and when are they being used? Just so people will know that, yes, the vaccine is here and wow, it is being used.
So I'll answer that. We do have our centralized website, miamidade.gov/vaccine, where we're providing all of the updates from all of the partners. And so we will post as that information is made available to us. It is not a single point of entry. So we're not counting down universally, but we also know that the governor's strategy is to make sure that vaccines get out there. And he has said that if there's vaccine that is not being, which it's all recorded in the state system, the shots. So it is recorded how many doses have gone out, and they keep track, obviously, how many they distribute. So if it is not being utilized, it will be recalled and moved to another provider.
I'd like to mention something real quick, and that's about how the vaccine.
You want to introduce yourself, Dr. Marty? Maybe everybody knows you, but not sure.
Hi, this is Dr. Eileen Marty. Thank you for allowing me to speak. About the distribution of going first to the elderly, that's the appropriate distribution for any location that has widespread community distribution of the disease, of the wild virus. And that's why it's working and makes sense in states like Florida and Texas and anywhere that there is an out of control outbreak. If there were a community that had the virus under good control, then you can prioritize border management and different personnel. But I think that's an important concept, is what is the situation in your community? And then what is the impact of giving that vaccine to an individual? How does giving the vaccine to this individual lead to reduction in problems for the entire community? And that's why it's very appropriate what we're doing.
Thank you. Next up, we have a question from Tony Pipitoni.
Hello. Just had a question for the hospital executives. The governor yesterday was saying that if you didn't use the vaccines, he was going to lower the allotments. Do you think he was talking to any of your hospital systems and that he feels that you haven't been pushing the vaccine as much as you could have?
I can answer that because I was with him even before that. He was not talking about anyone specific. He did say that he's seen some hospital systems around the state that was not fully utilizing it, and therefore he was going to pull it back. And actually, that's a little softer than what New York is doing, and they're actually going to provide penalties to some of those. But I would tell you from what I've seen from our partners here in Dade County, every one of these hospitals are trying to, everyone, because we talk on a regular basis, all we're doing here is trying to make sure we push all that vaccination as fast as we can.
I would agree with Carlos. He wasn't talking about us. And we had a call yesterday with the Surgeon General from the state, and he reported that there were 100 hospitals around the state of Florida who'd only used 50% of their vaccine. So they wanted them to use them or give them back. And that's not us. We're all using it as quickly as we possibly can.
Great. Next up, Doug Hanks.
Thank you. Can I ask the health department, we're seeing community sites opening up in Broward County by the state, but not in Miami-Dade. Did you say that next week the state will start doing that?
In Miami-Dade, we're doing things a little bit different. I'm working very closely with Miami-Dade County and the different municipalities to make sure that it's a coordinated effort and doing the best that we can for our community. What we're doing in DOH, we are augmenting the resources with the county as a whole by being having clinics just in DOH. But I'm working closely with the Office of Emergency Management, obviously the mayor's office, to ensure that it's a county-wide community effort.
And Doug, one more thing on that. We're doing the things we're doing different than Broward. We are doing things by appointment, not by letting people just show up. And we want to make sure that those appointments are all have doses before we provide the appointments. So we want to make sure that we are level setting expectations, which is something that's been out of control in some other counties in the state.
So does the Department of Health have clinics open in Miami-Dade County right now?
Right now, what we're doing, we have set up some strike teams that have been going out to clinics that provide services to individuals over the age of 65. We've also been trying to vaccinate my staff, which are in the front line, to go out and vaccinate additional individuals within our community, and also trying to identify areas within our community that are in need of vaccination for us to be able to go out and vaccinate them as well. So that's what we've been doing locally, and also troubleshooting our processes so that when we do open up our clinics, it runs as smoothly and as efficient as possible.
Great. Thank you, Doctor. We have a few more in the queue. We're going to go a little past 4, and I think we'll be able to get to all the questions that we have. So Ramiro Inguanzo is next.
Thank you, Rachel. Hi, everybody. This question's for the county regarding homebound seniors. I heard Mayor Levine Cava reference that the county is reaching out to homebound seniors. So does someone, if you're a homebound senior, do you need to be registered with the county somehow? And if so, how does a senior do that?
Thank you for getting the clarification. The homebound seniors are those that are in the county's direct care. So those are the ones living in our housing, public housing, subsidized housing. Also, those we provide in-home services to through our Community Action and Human Services Department. So it's a limited pool of people. I believe that it is also part of the Miami Beach strategy to use their fire EMT personnel to do home visits for homebound. And I'm encouraging other cities to do the same so that we can start to address those needs. It is not it's not the same as the large volume, the quantity approach, but obviously these are people in great, great need. And hopefully there's going to be an effort through public and private providers once it's clear what's coming down from the federal government to assist us.
Great, thanks. Next we have Anna. I'm not sure if that's Ana Cuervo or another Anna. Okay, we'll come back. Anna, if you're still on, we'll come right back to you after the next question. Sam Gross.
Thank you. I have a question for Mr. Nagoya. You mentioned that you want to avoid overbooking or overpromising people who are signing up for vaccinations and not being able to get a shot in the arm. As we speak, Glenna Milberg from WPLG is reporting that people are being turned away from the line today at Jackson. People who had signed up for vaccines this morning, saying that there wasn't enough vaccine. Is this a problem of supply? Is this a problem of overbooking people? And what is Jackson going to do to resolve that problem in the future?
If you have anyone that has said that, I would like to know who that is, because we have not run out of vaccine. We have taken everybody there, and we have not turned anyone away from any one of our lines. We have 3 lines going on, one at the Linden Rehab Center here in Jackson Memorial, one at the North Dade Health Center in Miami Gardens, and one at Jackson South. And we're only on our 2nd day of vaccination. We have 6 more days of vaccination. We got plenty of vaccine left, so no one's being turned away for not having enough vaccine.
Is Anna on to ask a question?
Yes.
Okay, you're up.
Sorry about that.
No problem.
Yes, Mr. Migoya, my apologies, because I know that you answered this in English, but in Spanish for our viewers, many were disappointed when they went in at 11 a.m. That's the way that I reported it from the press conference, that the link would be up at 11 a.m. At what time was the link up, and in how long did it fill up? And why did that happen? A lot of people were expected to start at 11 a.m. and to have ample opportunity to get an appointment with Jackson. If you could answer that in Spanish, if you could.
Happy to. Nosotros hablamos anteriormente que íbamos a tener el website abierto no más tarde de las 11 de la mañana. Estuvimos trabajando por todas las horas de la noche tratando de estar seguro que estuviera abierto esta mañana. Gracias a Dios, operacionalmente estaba listo para abrir más temprano, y tomamos la decisión de abrirlo en cuanto estaba listo, que eso fue más o menos un poco después de las 9 de la mañana. Obviamente estamos en Miami, que quiere decir eso, que nadie sigue las reglas que uno dice, y por eso estaban todo el mundo entrando en el website, viendo exactamente cuándo estaba abierto. En cuanto se abrió, empezaron personas a tomar citas sobre eso, y a eso de las 11:15, 11:20, estaban las 14,000, las 12,000, mejor dicho, las 12,000 citas totalmente tomadas. Quedaban otras 2,000 citas que se abrieron por un rato esta tarde, y no sé exactamente dónde estamos en este momento, porque casi seguro que esas últimas 2,000 citas también estaban completas. Desgraciadamente, lo bueno y lo malo a veces se paga de la misma manera. Abriendo temprano, a veces uno paga malas condiciones. Lo más importante de esto, que personas de la comunidad todos tomaron citas sobre esta situación en Miami-Dade County, y van a estar vacunados por los próximos 7 días.
¿Cuándo lo van a abrir otra vez para citas adicionales?
Estamos en este momento esperando el Departamento de Emergencia del Estado que nos dé adicionales proporciones de esta dosis. Esperamos para el jueves o quizás el viernes lo más tarde que nos den dosis adicionales. En el momento que tengamos esas dosis, vamos a abrir citas contra el número ese de dosis. Así que vamos a estar en ese mismo website, vamos a decir exactamente cuándo va a ser, y también por social media y por todas las diferentes medios vamos a estar dejándole saber a todo el mundo en el momento que vamos a abrir el website para tener estas posibilidades. Esperamos tener un número similar de 14,000 dosis, y en cuanto la tengamos, igualmente vamos a hacer una proporción de 2,000 dosis por día para tener los próximos 7 días también ocupados.
Great, thank you. I know your hand isn't up, but I think that Patty Mitsay has a question as well.
I do, thank you. My question is for Dr. Villalta. I didn't really understand your answer to Doug's question earlier. I'm sorry. It sounds like what you're saying is that the health department's office in Miami-Dade County is not making its vaccine allotment available to people to sign up, but rather you guys are deciding how to allocate it based on what you guys determine are the needs in the community. Is that right?
No, that's not entirely correct. We started off, when we got our shipment, we started off trying to go out to these, providing outreach to the target population. But we're also working on trying to provide vaccines within our clinical sites as well. We're just trying to finalize those plans so that we're able to open up and have those appointments readily available to individuals without any delays. But we are in the process.
Broward has been scheduling appointments for days. I don't understand why is it taking so long?
Because we want to make sure that the system works as effective as it can be.
Thanks, Doctor. Jimena Tavel has a question.
Yeah, thank you, Rachel. Appreciate it. So my understanding is Florida does not have a statewide residency requirement. So I'm hoping some people can weigh in on this in terms of, can people from other countries, say, Brazil, Canada, Venezuela, just any other nation, are they eligible to take the vaccine here? Or are there in the process? Could you point out what would prevent them from doing that? I don't know who would be best equipped to answer that. Maybe Dr. Villalta or just, anyone. Feel free to jump in.
Well, I'll say that we heard the governor address this question at the press conference. Was it yesterday? In any event, he said that if people lived here even part of the year, that they're basically residents. So he's not seeking medical tourists or tourists in general to take the vaccine. But if someone is actually residing here, even if part-time, that would be enough for his purposes. I don't know exactly what screening process is. Somebody else could speak to that, but that was the governor's direction.
Correct. And on behalf of, in DOH, we do not ask for proof of residency or documentation of that. All we do require would be a picture ID.
So if I take my passport, say I am from Argentina and I come in with my passport, that's picture ID, what would prevent me as a medical tourist to not receive that vaccine?
We would then have to ask if you would be here for the second dose and to see how long you will be residing in Miami-Dade County or in the state of Florida.
Right, and tourists are allowed to be here for up to 3 months. So if I come in and I stay here for 3 months, that means I'm here for both doses. So what you're saying is you can get both doses if you're from another country.
From DOH, we would not deny that person because that's a person that would be able to protect not only from one getting infected, but also to spread the virus to other individuals and infect other individuals within our community, and also end up in our hospitals and cause sequela.
Great, thank you. We have one more question.
Rachel, let me add something and then a clarification if I can. The governor did say that obviously if these people are in our communities in the state, and specifically Miami, especially with the fact that we have so many foreigners that live here part of the time, including 3 or 4 months a year, that obviously preventing the disease from spreading, whether you happen to be a citizen from another country or this country, the idea of vaccinating these people and stop them from spreading was the value. So that's really the focus that we have there. I just want to clarify something from what I was asked before. We have not turned anyone away for lack of vaccine. We did find out, I just found out that one of our sites, due to the fact that this was the first day of appointment, we had way overbooked in one location. And even though we had many of our staff staying for a longer period of time, we did give the option to so many of those people to come back tomorrow at any time to be able to get their vaccine, not because we were out of vaccine, but because we were running out of time with the big number of lines that we had. And we believe that tomorrow is more stable. So it wasn't we turned them away. We did give options of being able to come back tomorrow, and a group of people decided to come back tomorrow. Thank you.
Great, thank you. And we have a final question from Veronica Zaragovia.
Hi, thank you so much. With this opportunity to have hospital systems in one press conference, what I was hoping to get response to the comment from the governor about how he thinks that the hospital systems are better equipped to handle vaccinations. As we move forward, thousands of more people are going to need to get vaccinated. And a lot of times the media is left answering questions like they got an email from Jackson with a confirmation, but no number or no time. And we don't have the answers. And I'm wondering if it would be helpful actually to have a little support from the state to make it a little more organized so people have a place to ask these questions.
Let me again answer what the governor said yesterday. It wasn't that he said that he was providing the vaccines. The idea was not to have a centralized appointment, but let every venue provide the appointment. So as he was talking about specifically hospitals, he said he gave the vaccines to hospitals and allowed them to come up with their own set of appointments. He was not talking about anywhere in Miami, but he was talking about other hospitals that did have problems with their appointment settings. And he said that the state was not there to set those appointments, but each individual place to do it. He did not say that hospitals would be the only place to vaccinate. He said that he was specifically talking about appointments to those hospitals. And then later he talked about the fact that he will have some sites and he's looking to also work with the county here and with us to open additional sites here whoever opens the sites will then be in charge of making sure that they would provide their own appointments and so forth, rather than the state. That's a clarification at that point in time.
But ultimately, do you feel this was the best way for each county and each hospital to have its own website and phone number and everybody do it differently? Or would it help to do it another way moving forward?
Not really, because only the venue that's providing the vaccine knows how many vaccines they have. So if Jackson were to allow the county to do it, how would the county know how many allocations we have and how many appointments? So it's best for each institution to be able to provide its own appointments.
Thank you.
Actually, we've talked specifically about having that kind of a centralized site, and then that centralized site would feed people into each distribution center, hospital, or whatever that's providing it. And I think those conversations are going forward, because that would be the more logical way to do
it. So if I may, Rachel, I'll just say a few words in closing.
Yeah.
So again, I want to thank everybody. This has been really one of these occasions in which you can see that we are working together as a community across hospital systems, across cities, across agencies, across governments, and that's what it's going to take, and across universities. That's what it's going to take to solve this problem. We are in an emergency. This is not something where we're leaving people just to go their own way. We are coordinating, we are communicating. There is a centralized website that does link to all of the facilities doing distribution. It's not yet a common entry point for appointments, something to explore, but several of the entities distributing are combining forces even on that aspect of it. So whatever, that there is one central point of information to help avoid the confusion, the anxiety for the public. That's what we are aiming to do. And through our Office of Emergency Management, to make sure that we are deploying the resource, the vaccine, as effectively as possible countywide. So I want to thank everybody for making that possible. Again, it's miamidade.gov/vaccine or vacuna, or the Haitian Creole word, vaccin. And to our leadership in Miami-Dade County, who have been so supportive of this effort through the pandemic, through the federal dollars, and now through the distribution of this vaccine. We give thanks, and to all of the staff in the county and the hospitals, the universities, the health clinics. We stand with you. We appreciate you. We know what an incredible sacrifice that you are making on behalf of the entire community. So thank you very much, everybody. And stay tuned.
Stay safe.
And safe.
Bye.